Good evening, everyone. I'm Sharon Bond, Director of New Student and Family Programs. Thank you for joining us this evening for our Q&A on supporting student health, well-being, and success. Joining me tonight are staff members from our Health and Counseling Center and the DU COVID Coordinator, and Beth Goad, Assistant Director of Family Programs. You've been receiving emails from our office inviting you to our webinar series over the summer to help you learn about resources at DU for you and for your students. And we're recording each of our webinars and placing them on our website, along with other helpful videos from our campus partners. A link to our website is in the chat right now, and that is crimsonconnect.du.edu/NSFP. We'll also send our recordings to you by email once the editing is completed after each of our events, so you don't have to go looking for them. If you haven't been receiving our emails, please let us know by sending us an email at parents@du.edu, and we'll make sure that you're added to our list. When you have questions for us, please use the Q&A button on your screen. You can add questions there anytime. Parents are muted during this conversation, so our panelists will read questions, or we will read questions that apply to tonight's subject of health and wellness, and we'll answer those questions live. To be respectful of everyone's time, questions that are of a different topic or questions we just don't have the answers for yet will be answered in our follow-up email after the event. We're also going to include information about our upcoming webinars in those emails. So let's start off with an introduction of our panelists, and then we'll go to your questions after that. Would each of you begin by doing an introduction of yourself and your role here at DU, and maybe a quick overview of the resources in your area for parents and students? Can we start with Kim?
Sure, thanks so much, Sharon. Hi, everyone. It's good to spend some time with you virtually. My name is Kim Liao, and I use she, her pronouns, and I serve as the Director of Health Promotion in our Health and Counseling Center. I'm going to ask my other colleagues from the Health and Counseling Center, or HCC, to introduce themselves, and then we just have a couple slides to share with you. Chris?
Hello, I'm Chris Guerra. I'm the Director of Finance and Administration for the Health and Counseling Center, he, him, his. And we handle everything behind the scenes. So we handle questions about the health and counseling fee, we handle the student health insurance, we help students check in, pay their bills, and navigate the system as best as possible. And Jack.
Hi, everyone. Thanks for joining us tonight. I'm Dr. Jacaranda Palmatier, she, her pronouns. I am the Director of Counseling Services here at the Health and Counseling Center, so I oversee all of the mental health services and resources that we have. So I'll turn it over to Dr. Odell.
Good evening, all. My name is David Odell, and I'm the Medical Director here at the Health and Counseling Center at the University of Denver. I'm a family physician by training. I've been on staff for about 10 years now, and I oversee all of our medical staff. We have other medical providers, including physician assistants, nurse practitioners, medical assistants, nursing staff. And I like to think of us as a primary care office. We just happen to be located on a college campus, there to serve all the medical needs for your students as they are welcomed into DU. So nice to see everybody. And I'll throw it over to Sarah Wademara.
Hi, I'm Sarah Wademara. I'm the university's COVID coordinator. I'm also a professor in the psychology department and chair of the psych department. And I use she, her pronouns. And I will be giving you some information a little bit later about where we're at, how last year went, and our plans for releasing more information about the fall.
Wonderful. Thank you, everyone. So I'm going to go ahead and just share a couple slides about the Health and Counseling Center. This is meant to be somewhat of a preview if you have not yet had the chance to watch the Health and Counseling Center overview, which is available on the New Student and Family Programs website that Sharon pasted into the chat. So if you haven't seen that, we would highly encourage you to check that out. It's got a lot of great overview information about programs and services, as well as health-related costs and coverage, and our contact information. And we have our wonderful colleague Chisholm, who's a member of our administrative support team, narrating this presentation. Our mission at the HCC is to enhance overall student well-being and success, and we do that by providing inclusive physical and mental health care, prevention, education, advocacy, and recovery support services. So as reflected in our mission, our team does a lot. We are split up into 6 different units. Dr. Odell is representing medical services. Dr. Palmatier is representing counseling services. We also have our Center for Advocacy, Prevention, and Empowerment, or CAPE for short. CAPE provides support for survivors of gender violence. We have the health promotion team, which is my team. We do education and prevention work for students on topics like alcohol and other drugs, mental health, sexual health, and gender violence prevention. We've got our collegiate recovery community, or CRC, which provides support for students in recovery from substance use disorders. And we have our administration and finance team, which Dr. Wera heads up. We just wanted to share our contact information in case after our Q&A tonight, you have specific questions regarding your student's health or other questions that pop up. Our phone number, 303-871-2205, as well as our website, du.edu/HCC, are great ways to reach us. We are open Monday through Friday during the hours listed there. And when your student gets to campus, they can find our main location, medical and counseling services, in the Ritchie Center, and then our collegiate recovery community, CAPE, some of our counselors, and health promotion in the other locations listed. The last reminder we had is that as you and your student are getting ready to come to DU, we do have a couple reminders for you. The first is for your student to submit their proof of immunizations, the ones listed here. We do have more information about that requirement on our website. They're also going to need to either select or waive health insurance, and they can do that via their Pioneer Web account. And then when your student is on campus, they will have to complete an active bystander skills workshop called Intervene DU. And they can actually already go ahead and sign up for that workshop. All right, I think that is it for us. We're happy to take your questions, and I'm going to pass it over to Sarah for a couple of updates related to COVID.
Thank you. All right, so I have been the university's COVID response coordinator since March 1st of 2020, when many people weren't thinking too much about COVID. We had a very comprehensive and thorough response to COVID across the last academic year, and we were able to be in person successfully. And we had over 2,000 students living on campus the entire year. And they were able to stay with us through the full year. So we have handled our COVID response with our health partner, which is National Jewish Health. And we have testing and lots of different processes we use on campus to keep really on top of things. Conditions are great, and they've been great for a while here on campus. And they have never been more than half the case rates that we see in the Denver community. So overall, we feel confident in our ability to manage COVID. We're closely watching the Delta variant, and we're actively making our plans to respond for fall. Our intention is to release our fall plan in the middle of July. That's the same thing that we did last year for the fall start last year. So we are revising all of our protocols and taking into account current conditions, and we will have that information publicly available for you and for anyone who's interested in the second half of July. And happy to take any questions on where we're at now.
Thanks, everybody. I think we do have a few questions that I'd like to go ahead and put out there. And I see that this question was answered privately, but I think that it would be worth bringing up that if students do have a health condition which requires daily meds, are there other resources at DU that parents should make sure that they are aware of? And what do they do when they need to bring medication to campus?
Yeah, that's a good question. The University Health and Counseling Center has the ability to do some medications on site, and we do have a limited pharmacy that stocks the most common medications that students might need, but it's not a full pharmacy. And so we have 2 local pharmacies that I'll place in the Q&A section close to campus that folks can have medications transferred to. One is a Walgreens and one is a Safeway pharmacy. We do offer allergy immunotherapy, which is a common request, as you might imagine, in this age group. And so we do offer allergy injections and allergy immunotherapy at the HCC. We've got a great nursing staff that oversees that program for us. And then we've got the ability to prescribe medications throughout the entire spectrum, including, as you might imagine, maybe stimulant medications for students that might have ADD diagnosis and those kinds of issues. We also have a couple of psychiatrists on staff that can prescribe medications for folks around mental health conditions and similar conditions for that. We don't do any IV infusions at the Health and Counseling Center. We do have the ability to partner with a local hospital system, Centura, and they have an IV infusion center close by to the health center, and we use them often. But the pharmacies that we use locally are most likely Walgreens and Safeway, and allergy immunotherapy are probably the most common things that we do at the HCC.
Thank you very much for that. Another common question that we have been seeing is, what is the difference between the student health insurance plan and the health and counseling fee? And what does that health and counseling fee cover?
Probably I'm the best person to handle that question. So for undergraduates, the health and counseling fee is a mandatory fee that the university assesses for all students carrying 6 or more hours. What that gives students is a wide variety of low-cost services, from medical to counseling to CAPE to health promotion. So students can come for an unlimited number of visits at a copay, typically $15, and they have reduced costs for labs or for quick things that we can do in the clinic. And so for the majority of students, like 90% of our students, that is going to cover the majority of their healthcare expenses while they're on campus. It also gives them 24/7 coverage when we're not open through our after-hours providers on counseling and mental health. The student health insurance is your major medical insurance, which students are also required to have. So you can have the DU health insurance, which we've partnered with United Healthcare, and that is $3,550 for the full year. It's billed in the fall and the spring. If you have your own insurance, you can waive that fee. Undergraduates can waive that fee. You just have to look and make sure that you have coverage in the area for kind of anything but emergency type of situations. A lot of insurances are now very limited to where the parents are geographically. So you just want to look at your coverage. You can call our front desk to kind of inquire about your insurance and see if you feel comfortable with that. But if you feel you have adequate insurance, you can go into Pioneer Web and waive the DU health insurance. But the health and counseling fee is going to be there, so encourage your students to come to the Health and Counseling Center. They've already paid for the majority of the visit. We're student focused. That's what we've been doing for forever. All of our providers here have been here for a very long time. And it's to your advantage to have your students use the Health and Counseling Center.
Thank you. Here's another good question. Many parents on Facebook are talking about getting COVID vaccine waivers for their freshman students. How will DU handle parents who do not believe in the vaccine? If students want to get the waiver, in different situations, when students are not comfortable doing that, how is that handled at DU?
Sure, I'm happy to take that. And we do have an extensive page that you're welcome to review, and I can drop the link in the chat. I will tell you that I read the question in the Q&A, and I see 2 separate parts to that question. So one is about what is it going to look like? What is the exemption policy and rate on campus? And our exemption rate is teeny tiny. We have less than 1% of families that have requested an exemption, and many thousands of records that we've processed. So it's our expectation at this point that the vast majority of our students will be vaccinated. We do consider exemptions for medical and non-medical reasons, and you can read more about those. And it is a request for an exemption that is what you put in if that is where your family is. There are different specific questions on the exemption form. And one of them is they all came from questions that we got from families. And so one question that we got from families often is, listen, we'd feel comfortable with this when it's FDA authorized, FDA approved, but right now it's FDA authorized. So that is actually a choice. So you can choose an exemption request because it's FDA authorized and not approved. However, when a vaccine becomes FDA approved, we would then recontact those families and ask for vaccination at that time. So it's our expectation, and it's consistent with what's been happening, that our population will be mostly vaccinated. With the second part of the question that I saw is, if I am or my student is vaccinated, would I have to be quarantined if there is an outbreak? We have to follow the Denver Department of Public Health and Environment requirements. And at this time, the requirements are that you do not have to be quarantined if you are fully vaccinated and exposed to someone who is positive for SARS-CoV-2. Now, that could change, that recommendation could change, and we would be obligated to follow the public health orders in the location where we are. But right now, that's not our practice, and that's not the current requirements.
Thank you. Also related to that, are the vaccines available at the HCC? This parent would like to have a specific vaccine, but their local MD does not carry it.
Yeah, I can take that question. The HCC offers a full complement of vaccines. I would say the one vaccine that we don't have right now is a COVID vaccine, because we have vaccinated a large portion of our community, but also you can get a COVID vaccine just about anywhere these days. Certainly here in Colorado, they are just a walk down the street. For other vaccines, we have them on site and offer them daily to eligible students. DU places a strong emphasis on travel abroad, and so we also carry a full complement of travel vaccines should that be necessary for any upcoming students that might be traveling for their term abroad. So yes, we do have a number of vaccines available at the HCC and give them regularly and routinely.
And just to add to that, we have administered, in partnership with National Jewish Health, we have administered over 31,000 doses of the COVID-19 vaccine, and the vast majority of those have been Pfizer. We have international students who have not been able to access vaccine where they are located, and a few other populations that have asked. And so it is our intention to offer vaccine clinics on campus, one in July, one in August, and one in September. I think that will meet the need that's been expressed. But we are able to host additional events should that be something that would improve access for folks. So I completely agree with David. You can walk down the street to Safeway, but it is also sometimes for people more comfortable to have that type of thing happen on campus where they're around all of us.
Thank you for those answers. Here's a new question. Even if my child has health insurance, can they still get emergency care from DU? If so, should they still pay for it, or is it covered by DU?
David, I think you're probably better to answer that, and then I'll follow up.
Can you repeat the question, please?
Yes. My child has health insurance, but can they still get emergency care from DU? If so, should they still pay for it, or is it covered by DU?
So DU has sort of a dual structure system. We are a student fee funded entity within DU. So there's a health and counseling fee that is attached to that. But then all students are required to have health insurance. Should a student need care outside of the health and counseling center, that's pretty much when that health insurance would kick in for coverage for them. Let's say they were seen at the health and counseling center and were determined that they needed a higher level of care than what we could manage, maybe concerns for appendicitis, let's say. If we referred a student locally to the emergency department, that's when their insurance would kick in. If that student had questions or concerns about where to access care, they can always start with us at the Health and Counseling Center. Again, think of us like your primary care doctor. If they're concerned for an ear infection, if they're concerned for belly pain, if they're concerned for a mental health concern, we can always see folks at the Health and Counseling Center first. And then if they need, based on a triage and an assessment and evaluation, a higher level of care, then we can refer them out. And that's when their health insurance would kick in and cover them for that additional care, should that be the case.
Thank you.
Thanks, David.
Did you have a follow-up to that one? CJ, sorry.
No, I think Dr. Odell handled that.
Okay, thank you. Here's a new question. Do you recommend that parents have power of attorney as well as Hipaa release?
So that's a very complicated one. I think the biggest thing to think about is that the students are 18, so they are adults, whether they're being supported by their parents or not. They're seen by the law as adults. So we do not do a blanket HIPAA release. It's a question that we get quite a bit. And the biggest reason, one of the biggest reasons about that is that we want the students to feel comfortable about coming to us in a way that their privacy is protected so that they can address their issues right away. If there is a need for the student to, or the provider to talk to the parent right away, of course, with the student in the room, it's one thing that we do is we would pick up the phone and talk to the student, do the HIPAA release there. And students can do a HIPAA release to their parents on an incident by incident basis. And so Dr. Odell and Dr. Palmatier, if you would like to kind of follow up on that.
Yeah, we typically treat each episode of care as an individual episode of care. And so we try to respect the students' HIPAA privacy. We understand that this is a very transformative time for them and they're kind of learning how the medical world works, let's say. And one of the important pieces to that is that their health information is their own. And should they want to share that with other folks, then we make sure that we get the appropriate releases for that, as we are a HIPAA entity. In that instance, we try to facilitate communication to the best of our ability, but we also respect the student's request to keep things private, should that be the case. If an emergency were to arise, as Dr. Ware was saying, then we always notify the emergency contact that's listed. But again, doing so such that we are always maintaining the needs and the requests of the student first, from the standpoint of as they are, making this transition into the world, that we would respect their wishes first regarding their protected health information.
I would just add from a mental health perspective that when someone is consenting and working with a therapist or psychiatrist, oftentimes we will sign a release as related to the medical issue in mental health that is presenting. I think with that, I often encourage parents, just so you know, in the event of a like life-threatening crisis, we are going to reach out and break confidentiality. So to not worry about that, if there was a concern that was life-threatening, we're always going to reach out as long as we have your contact information. I guess I shouldn't say always. Sometimes the contact information is not in the chart that we have, but we're going to reach out to you. And also, I think a lot of times parents, require their student to follow through with mental health treatment as a partnership for them to stay in school. And in that case, we can sign a release that is just on attendance. So really working with these students in this age range at kind of how do you negotiate that relationship and still have privacy and confidentiality when it's required, but also to work collaboratively with the parents. So we try to work very collaboratively, and we'll work to protect their confidentiality while also kind of making sure you feel like partners in the treatment when that's appropriate or needed.
Thank you for that. And also we realize that information is going to be sent out mid-July about the requirements for COVID protocol. But if we know at this time, will students, whether vaccinated or unvaccinated, will they be required to wear masks indoors in class?
Sure, I'm happy to take that. So at this time, it is not required on campus for fully vaccinated individuals with verified records. So that means uploaded into our system. to wear a mask on campus. And it is required for individuals who are unvaccinated, that's student, faculty, and staff. There's no, you're not wearing a sticker or anything that says whether you're vaccinated or unvaccinated. So it is an honor system, but that is our required policy at this time. We have done some and will continue to do more education to make sure that our entire community understands that there are a number of reasons someone might be wearing a mask. They could be immunocompromised, they could be unvaccinated, they could have a vulnerable individual in their home. And for any of those reasons, they might be wearing a mask. So we intend to do lots of education to support students who are wearing a mask, students, faculty, or staff who are wearing a mask, as that not being an indication of anything in particular about them. And like all types of discriminatory behavior, we would not tolerate discrimination on that status.
Thank you. This may have been covered earlier when we were talking about prescriptions, filling prescriptions, or having that done at HCC. If students have a prescription, can a doctor send a prescription to the health center? And also along with that, can doctors at the HCC prescribe for students?
Another good question. The answer is yes, but. The pharmacy that we have at the Health and Counseling Center is more of a dispensary, and it stocks some of the more common medications such as antibiotics and maybe asthma inhalers that students might need for episodic care. But when it comes to ongoing recurring medications, whether it be maybe medications for anxiety or depression, whether it be for other chronic medical conditions, we don't stock those medications routinely and regularly at the Health and Counseling Center. And so in that instance, we usually refer folks to the local pharmacies to get those medications filled there. We do have prescribers that can prescribe those medications, including stimulant medications for conditions such as attention deficit disorder. But we also have a very robust assessment and evaluation program when it comes to that ADD diagnosis. As we're all aware, these medications can be diverted on college campuses. Students that may not necessarily qualify as having the diagnosis use these medications, perhaps not as prescribed or haven't been prescribed them at all. And in that instance, we're beholden to a couple items there. One, we would like the student to have an assessment and an evaluation to make sure that the diagnosis is true and proper within 5 years of their attendance at DU. And we have an assessment coordinator that would review that. If that documentation meets our criteria, then we are able to assume that prescribing for that medication at the Health and Counseling Center, and we can do so within the state of Colorado because these are Schedule II medications and are subject to providers being able to provide those medications within the state that they are licensed and that they're practicing. So I would say the answer is a qualified yes. We do provide those prescriptions and can provide those prescriptions, but we have certain other things that we just need to make sure that are in place such that when we're prescribing, we've got the right diagnosis, we've got the right medication for the right student.
Thank you. I have another question about counseling. Is counseling in person or telemedicine?
Great. I will. I was just answering that one, so I'll answer it live. Currently, we're still doing the majority of our mental health treatment via telehealth. We will be making a pretty significant pivot as long as all of the protocols allow that. In August is our plan. Kind of throughout August is when we'll be switching back to having the majority of our staff on site and also the majority of our treatment in person. Having said that, we never know when that can shift. I think we found that telehealth is very effective for mental health treatment a lot of the time. We also are going to offer some telehealth when it's appropriate. I think what we learned is sometimes for accessibility or privacy reasons, sometimes telehealth is the most effective treatment modality for students. So I do anticipate the majority, though, being done in person starting in August and for all of fall quarter.
Thank you for that. There's another question here, and it may have already been answered somewhat in the earlier question about Hipaa, but and it just disappeared on me. I think someone's answering it right now by typing. Oh, let's go with this. How do students give their Hipaa release?
The easiest way I'll put this in the chat is that there is a Hipaa form that the students can download, and they would sign, and they can pick how wide of a release that they would want. And then they would send it to us. They could do it at the time of the visit. They could do it after the visit as well. So that's the easiest way to do that. I'll go find it and put it in the chat.
Thank you.
Sharon, I can also answer the questions about accessing mental health services. So I think a few people are asking related questions related to how soon can you get in, how to access it. Basically, you can come in as soon as you have coverage, which and Chris, you can correct me if I'm wrong, but is September 1. So some students do come in during that orientation week as first year students. We also, students that are coming to campus this fall are already in our system. So you can send us, send us information, you can contact us. You know, we are always happy to have a heads up about someone that wants to get connected to our services. And there's a lot of ways that people can get connected to our services. Students can go on the website and actually make an appointment for an initial triage appointment without having any contact with anybody at the HCC. They also can just call our main number and talk through with our awesome administrative support staff in terms of what is the appropriate appointment to make. We find that a lot of our students really appreciate the web booking option. Chris, is that live for students as of September 1, or is it available before then?
I'm sorry, I was trying to find where to respond. Could you ask that again? Sorry.
For students that are trying to web book an initial counseling visit, is that available? When does that become available for students that are
So we roll over the year, August 1.
August 1.
Or it's about a month ahead.
Okay.
And mainly that's because we have to take the eligibility where students have registered first and be charged a health and counseling fee. So once they've registered, then they're eligible students, and then they're able to go into My Health and do everything. Right now, they're able to get in and upload their records, those type of things, but not schedule appointments yet.
Yep, so that's great. So I think for a student that knows I need to start meeting with someone initially, or I want to get connected with someone so I have someone on campus, you know, they can go in and make that initial appointment. So they can come in right in September. And again, please, you all as parents are welcome to give us information ahead of time, and they're also welcome to contact us ahead of time. We get a lot of those calls in the summer. We expect them starting in July and through August, just people giving us that information. So we make sure we have good continuity of care.
And I think once you get past August 1, if the student's not able to do that, because it kind of varies on the registration dates, you can always call our front staff and give the student number, and they can help you through that process to work around the ability to self-book.
Thank you for those answers. Let's shift back over to COVID a little bit. There was a question about a student who already had COVID and whether or not students would still be, if we have a mask requirement on campus, would all students regardless be required to wear the mask? And will there continue to be COVID testing for students regardless of vaccination?
Sure. That question about COVID, having had COVID previously, and what implications that might have for other policies is under consideration. But it is my expectation, based on the medical information we've been given so far, that we likely will have a designation of fully vaccinated or not fully vaccinated, and prior COVID will not replace vaccination. So that's my expectation, but that will be in the plans we release at in the second half of July. The second part of the question, it is my expectation at this point that we will test everyone on arrival, the entire community. We are returning to full density, so we will have our entire 13,500 person community here with us. And for that reason, and coming from all over the world, for that reason, it is my expectation that we will ask everyone to test on return. What the frequency of testing will be after that point. So for people who are vaccinated and people who are not vaccinated, that's another important decision point that we are making now, and we will share with the community the second half of July. That is also probably, of all the other factors, that's probably the thing that is least stable, because testing frequency is the variable we change whenever conditions change. So when things become more uncertain, we increase our testing frequency, and that's how we identify any concerns on campus and respond quickly to them. We do provide testing on campus for free, and anyone is able to get a test at any time. We continue to strongly encourage anyone with any COVID type symptoms to be tested immediately. And right now we do have required testing for both vaccinated and unvaccinated folks, but it is much less frequent for individuals with verified full vaccination. So more information to come on that, but I also, we'll make sure to say in all of those documents, and I want you to hear me say now, we change our testing frequency pretty quickly whenever things seem like there might be an issue, particularly in what's called by the public health officials congregate housing. So that would include our residence halls and also our fraternity and sorority life housing.
Excellent, thank you. Is there another outstanding question someone else wanted to answer, or should I go on to the next? Okay, I'll go ahead and go on to the next. Do you have therapists specializing in trauma and or EMDR? If not, do you have referrals for therapists who specialize in this?
That's a great question. Yes. Working on a college campus, most of our clinicians are pretty familiar with working with trauma. We do also currently we have one staff who's EMDR trained. We're actually in the process of hiring 2 half-time trauma specialist positions. One is a permanent position, one is a 2-year appointment. Really recognizing after this past year that is a significant increased need for a lot of reasons. And some of the need was there before, but I think that we recognize the need for that. So I always encourage students and parents to have the student come to us first, reach out to us, have that initial triage appointment with us. And, we will work with students around what's going to be the best coverage or best treatment for them based on their level of need, based on their presenting issue, based on how frequently they want treatment, how frequently we think they need treatment. So our providers are really adept at figuring out like, okay, this is a great person for us to see on campus, or someone it's like, no, I want to meet with a counselor twice a week. We will work with them to find a good referral for them in the community based on their presenting issues. So I think it's always helpful to have that student come for that initial appointment, because a lot of times, I say usually 85 to 90% of the time, we're really going to be able to provide the services that that student needs.
And I think just to follow up on that, it's a really good question on should you get the DU student health insurance or not. I did misspeak earlier. It's a $20 copay, not a $15 copay. But when you have the combination of the health and counseling fee and the student health insurance, you wouldn't have that copay. So if you use the services at the health and counseling center, you're going to have basically unlimited visits with no copay. And then, of course, our providers will work with the frequency if they can and the needs. The other thing is, since it's United Healthcare, it's a nationwide network, has a low deductible, a low copay for those type of services as well. So it can be used both in Denver if there's a referral out. It can be used back at the parent's home or the student's home. So it's a pretty flexible plan, and we've really structured around students. So it's a great, what we see is students that have both the health and counseling fee and the student health insurance are the students that really do use our counseling and our medical services more frequently, which is a win-win for everybody.
This one may have been covered and I might have missed it, but what is the amount of the health and counseling fee?
The health and counseling fee is $200 per quarter. It's assessed automatically fall, winter, and spring. You can, if the student stays in Denver, you can manually enroll for it in the summertime. And so it kind of depends on what the student's doing for the summer, but it's going to be $200 per quarter.
Thank you. And also, I may have missed this one as I was looking through the Q&A, but what is the copay for services at the HCC?
It's $20.
20, thank you.
And again, 85 to 90% of the students, that's all they pay is the $20 copay. They sometimes have like a rapid strep, or they'll have a rapid flu, but again, those are usually typically $3 to $10 for those type of tests. Very low cost.
And Chris, for specialty visits or specialist visits, say psychiatry, the nutritionist, dermatology, what is that copay?
It's the same as this current year, and I am spacing, I think it's $40. Is it 45? It's between 40.
I think it's 40.
Yeah, I think it's 40.
Even if you don't have the SHIP?
So for psychiatry, I think it's 75.
Okay.
For our specialist dermatology, if we have gynecology, that's 40. Nutritionist is 40, and the psychiatry is 75. And then that's for a number of visits on the psychiatry side. On the dermatology and the nutritionist, it's unlimited at that rate.
And Karen, go ahead.
Sorry, I was just going to say, for people that have both the SHIP and the health and counseling fee, all those specialty, there's no copays, right, for the specialist visits?
That's correct. Again, we've built that plan where we hold some of the student health insurance premium centrally, and then we basically pay those copays out of that. So if you have psychiatry needs, it's a really compelling thing to look at with having both of those. Again, you also have United Health Insurance, which is outside of that, which has a lower copays, low deductible, and very low out-of-pocket max.
And one more time, Chris, could you tell us what the SHIP fee is, the student health insurance?
It is $3,550 for the year, which is not cheap, but it's billed in the fall, and it's billed, so half of it's billed in the fall and half of it's billed in the spring. A lot of the students are under family plans, which are a lot of times employer plans. So if you're already in an employer plan that's on a calendar year, your student can get onto this insurance in January because that's the beginning of winter quarter. So what you'd want to do if you're interested in doing that, keeping the student on your plan through 2021 and then changing over, you would want to contact our front desk to make sure that you kind of get that going in motion, because it's a little bit more complicated because it's not an automatic bill.
Thank you very much. There's a follow-up question about physical therapy. Do students have any access to your sports med orthopedic doctors, physical therapy? And to confirm, physical therapy is not offered on campus?
That is correct. We don't have a physical therapy training program at the university. And so we don't have physical therapy clinical services on campus, but they are very close by. Not walkable, but certainly an Uber or a Lyft ride, or even an RTD ride, a train ride, very close. We can refer students to local sports medicine orthopedic physicians as needed based on their condition. We do have 2 sports medicine certified physicians that work on staff at the Health and Counseling Center, one that also works with our varsity athletes. So we have access to a number of sports medicine resources, not only at the HCC, but close to campus.
Thank you. Along those lines, do you also have, an auditory processing, an audiologist on staff? And if you do not, do you have any referrals that you could give out to parents if they were to contact HCC?
We do not have an audiologist on staff, but we do have a good relationship with a local ENT practice called Denver Ear Associates. They have an audiologist and a number of board certified otologists and neuro-otologists that have provided great care to our students over the years, and we can certainly facilitate that referral as needed.
Thank you. Right now, we have just one other question that's in the queue.
Sorry, Sharon, can I just add, I would also encourage
go ahead.
folks, if there's an auditory processing disorder, that they work with disability services as well.
Sharon, take that last question.
Thank you. Go ahead.
Okay, so it's a little non-specific, but it asks about unvaccinated students in residence halls. And so I'll just tell you where we're at with that. So if students are not fully vaccinated, so fully vaccinated students with verified records will be able to share a bedroom with each other. And students of different statuses may be in the same suite, definitely on the same floor, the same building, but not in the same bedroom. So students who are not fully vaccinated and those who are fully vaccinated would not share a bedroom, but you could share a bedroom in either group. There was actually no recommendation at the time that we set our policy, but subsequently the CDC has released a guidance around that topic.
A new question about the SHIP. Will the SHIP insurance cover an out-of-state student over the summer, or do I ask individual doctors if they accept United Healthcare SHIP? Is that the right terminology?
The answer to that is yes. So United Healthcare has one of the most robust provider networks, both on the medical and the mental health side. So your current provider probably already takes United. It's hard to find some students that don't, or providers that don't, but you can go onto United Healthcare and you can look for their providers and see if your provider already has that. It also covers students when they go study abroad. We actually have a lot of students that when they get to their third year, they will actually pick up the SHIP for that term, for that 6-month period, because it has outstanding coverage abroad. So it'll cover them if they go up to the mountains to go skiing, if they go down to Mexico to spring break, which I would like to do. I think everybody here would like to have a vacation. And it would cover them when they're home over the holiday breaks in the summer.
Would out-of-state issued Medicaid cover a student at DU?
Typically not. Since the University of Denver Health and Counseling Center does not bill insurance, we don't take Medicaid or Medicare. Having said that, since the copays are very low at $20, because the student's required to have the health and counseling center fee, the health and counseling fee, we will work with students that have difficulty doing that copay. We have several funds, an access fund that the student can apply to. Providers are very good advocates for this, and we don't want to have costs for any reason be a barrier to care. So while we won't bill Medicaid at this time, it's one of those things that we just kind of work around and make sure the student gets the care first, and then we kind of deal with the fees or any charges on the back end.
Thank you for all the great answers, everybody. Right now, the Q&A is empty. Oh, we have one more. Do you have GI specialists on campus?
Good question. We don't have GI specialists on campus, but we do have a good working relationship with some of our local GI partners. So we have a good relationship with Rocky Mountain GI, Rocky Mountain Gastroenterology. And they often can get our students in very quickly and see them for various and sundry conditions, everything from celiac disease to ongoing heartburn and reflux and a number of other conditions. And so we have over the years, as you might imagine, we're well positioned in the community, and part of our mission being doing public good. We've established a lot of relationships over the years with local providers, neurology, ENT, gastroenterology, cardiology, allergy and immunology. And it's been great working with our partners recently, National Jewish Health, leading respiratory hospital probably in the world when it comes to things such as COVID and other respiratory conditions. And so we feel confident that should a student have needs that might exceed what we can do within the walls of the Health and Counseling Center, we can get them referred to a local network of highly skilled specialty providers that can look after your student with great care.
Thank you. I have a new question. Does the SHIP provide for LGBTQ hormone therapy?
It does. So one of the things that we made sure that we included in our most recent sort of negotiations with United Healthcare Student Resources, understanding that this is a need for students that's ever evolving, is to make sure that we included that as a benefit. It does have some parameters around it, as most plans do, deductibles, copays, coinsurance. You'll still be sort of subject to those things within the plan, but it is a covered benefit through the student health insurance plan.
Thank you. A couple of questions about paying for the SHIP. Can I use my 529 plan to pay for the student health insurance plan?
So you should check with your 529 provider on that one. It's a little murky here because the student health, having student insurance is required by DU. However, there have been several instances where insurance, even though it's mandatory, has not qualified for a 529. So what you'd want to do is look at your work with your 529 provider to see what their determination is on that and rely on that. We've seen parents do both ways on that. For the health and counseling fee, yes, it would be a cost of tuition. That's been viewed as a cost of tuition. So that would be like computers or dorms or tuition required fee.
And along those lines, can a family's HSA be used to pay copays?
Yes. Yep, their card will go through where our vendor card is registered for that. So.
Thank you. Great. If a student is currently on COBRA that ends May of 2022, could they then enroll in SHIP?
They would not be able to enroll. Well, in 2022, yes. So that would be a loss of coverage. So what you would probably want to do when that time comes close is to contact our front office and try to figure out the best way to bridge that. The spring billing for the SHIP will start around the end of March. And so it's usually right after spring break, the beginning of the spring quarter. So you might have an overlap for a little bit. But if you do a loss of coverage, sometimes we can adjust for that, but it might not. I just call our front desk about a month ahead and we can help you through that transition.
Thank you. And another question about fees. Just to clarify, the health and counseling fee allows the student to go to the health clinic and they would be responsible for the copay. Correct?
Yeah, just the copay. Yes. And any small charges that they might have for lab work or for rapid tests.
Okay, the Q&A is empty right now. If anyone has any lingering questions, now is the time. Does anyone else have anything to add on to the answers that we've provided so far? No? And one question came in. If a student withdraws from school, does the student get refunded? I'm not sure if you're asking about the health insurance plan or if you're asking about tuition only, but we can talk about health insurance for right now in this particular group. So if a student withdraws from school, what happens to that fee they've already paid?
That's a little bit of a complicated question depending on when they withdraw and if they've used the services. And a lot of times we will see if a student has a medical or mental health withdrawal, that we will return some or all the health and counseling fee, but not always. But the student will have the option to continue the student health insurance for at least that period of time that they have coverage, so that they have the ability to have that continuity of care when they return back to their home under the student health insurance. So it's a case-by-case situation. We work with the student to try to figure out what is best for them to be able to deal with their individual situation.
Thank you. And this is the first time it's come up this year. I need to have prizes for this question. What's your advice for parents regarding cannabis use in Colorado?
I can take this one. Thanks for that question. It's a good opportunity to promote a resource that we are going to be releasing on the new Student and Family Programs website soon. We in Health and Counseling Center and other campus partners have put together a handbook for parents and family members to talk with your students about cannabis, alcohol, other substances, as well as topics including mental health and gender violence. So that will include some basic overview information about Colorado laws, campus policies related to cannabis, conversation starters, other information about effects of use. So would highly recommend that. I think my short answer here would be to help your student become familiar with the laws and policies in Colorado. A friendly reminder that although Colorado has legalized recreational cannabis, one must be 21 or older to partake. Additionally, DU prohibits the possession or use of cannabis on campus. We must comply with federal laws, and because cannabis is not legal at the federal level, we do not allow it on campus. That actually also applies even if the student has medical use of cannabis. If that student needs to use cannabis medically, they can work with our housing and residential education team to get an exemption for the live-on requirement so that they can find a place off campus to reside and utilize the cannabis. So get familiar with the laws and policies, have conversations about the effects of cannabis. We do some work in our pre-orientation and orientation sessions to try to dispel some of the myths or conceptions around, some people think that everyone in Colorado uses cannabis or everyone in college uses cannabis, which is actually not the case. So it can be helpful to interrogate some of those myths or preconceived notions around it. So that's just a little bit to start, but please do be on the lookout for that resource.
Thank you. And here's a good question. This does come up once in a while in our office as well, so I'm very curious to hear this answer. If a student has private healthcare plan, not the SHIP, and he needs a blood draw pretty quickly or another service quickly for this particular student is to check kidney labs, will that be an expensive blood draw through the Health and Counseling Center, or would it be better to try to get labs done off campus?
Good question. I would say it depends. So having private insurance means that we wouldn't bill that private insurance for any blood work or any care that the student would receive at the Health and Counseling Center. They would have the health and counseling fee, so they would get access to our services, and they would be eligible for discounts on labs done. But it depends on the lab that's done. Some routine kidney function testing can be as inexpensive as maybe $20. But if there are specific, maybe more complex or complicated testing that needs to be done, costs can add up. And what we usually say is we'll have that conversation with the student at the room at the time so they can understand what the cost might be, understanding that we wouldn't bill their third-party insurance and they would be responsible for the bill. They can always then take that invoice and try to submit it to their health insurer and see if they would be reimbursed for that. But sometimes there can be a high deductible, and it's going to come out of your pocket anyway. So I think it's going to be important to clarify maybe what the test is that is needed. We would discuss that cost with the student at the time, and we kind of help them navigate what might be best as far as what their needs are and their ability to accomplish that.
Thank you very much. One more question. I think we're going to need to make this our last question of the evening. How do we check to see if the services provided at the HCC are covered on our health insurance plans?
So the easiest answer to that is, since we don't bill insurance, we are out of network for all outside non-DU ship plans. Having said that, the copays, again, 85 to 90% of students have just a copay, which is typically $20. It's $20 copay, which is typically cheaper than a lot of the copays that private insurance have right now, especially high deductible plans. So it's always a good thing to have the students come to the Health and Counseling Center. We specialize in students. We do same-day appointments, so the student can wake up at 10 o'clock and be reasonably assured that they're going to be able to get an appointment that day or talk to somebody that day. And the copay would be the first thing that you would have for a fee. And if there are additional charges that are going to be there, the providers do talk with the student to try to figure out what insurance they have, the best way to deal with that. So we are out of network with all insurance plans.
Thank you very much for that answer. And we are exactly at time right now. It is 7 p.m. Mountain. This was a great session. I want to thank all of our panelists for being with us tonight on the Q&A. And thank you to the attendees for being with us and asking some very thoughtful questions. This was a great session. We'll follow up with you by email when we have tonight's recording edited and ready to publish. And remember to join us for our next Q&A, which will be on Wednesday, July 7th at 6 p.m. Mountain Time, which will include some staff from housing and dining. And we're going to discuss move-in day, what that will be like, how students will check into the residence halls, and provide an overview of dining options and resources. You'll see more information about that event and others and our upcoming webinars in our next email. And have a great evening, everyone. Thank you very much for joining us.